What if I told you the very places meant to save lives are actually putting them in danger? This is Kenya News Update today. Coming up, you'll discover why 15 treatment centers were just shut down across Kenya, and what this shocking crackdown reveals about a hidden crisis affecting over 1 million people. A nationwide inspection has just concluded, and the findings are a damning report card on Kenya's fight against addiction. The National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, led the charge. Their mission? To assess every single rehab facility in the country. The team visited 236 centers spread across 36 counties, but here's the twist. Only 135 of them passed the test. That's barely over half. These accredited facilities are the backbone of our national recovery response, offering nearly 3,800 beds for those battling addiction. But the inspection uncovered a dark reality lurking behind closed doors. 30 facilities were outright denied accreditation. And out of those, 15 were issued immediate closure notices, shut down, for severe violations that put clients at direct risk. We're talking about expired medicines sitting on shelves. We're talking about poor hygiene and unsafe structures. We're talking about a critical lack of qualified medical personnel when people need help the most. An additional 56 facilities are now on a watch list, forced to make corrections or face the same fate. This isn't just about bad management. This is a systemic failure. Dr. Anthony Omerikwa, the CEO of NACADA, revealed the deeper crisis. Most of the accredited centers are privately owned. That means quality, inpatient care is simply unaffordable for the average Kenyan family. And the public system? It's critically under-equipped. There's an acute shortage of public outpatient services. There's a desperate lack of community-based support. And specialized rehab for women and adolescents? Almost non-existent. But here's the part that will blow your mind. The last national survey data shows that over 1.3 million Kenyans urgently need treatment for alcohol and drug use disorders. 1.3 million people. And the system built to help them is crumbling. This crackdown exposes the gap between the promise of recovery and the painful reality on the ground. It underscores the urgent need to implement the president's directive to establish at least one public rehabilitation center in every single county. The call is now out to county governments to prioritize accessible treatment. The call is out to development partners to invest in community-based care. The goal? To ensure no Kenyan is left behind in the journey to recovery, restoration, and reintegration. So, what does this mean for you? It means the safety net for our most vulnerable is full of holes. It means a family seeking help for a loved one might accidentally place them in a facility that causes more harm. Some will say this crackdown is a necessary purge to raise standards. Others will argue it reduces already scarce beds in a time of overwhelming need. But the biggest question remains, with over 1 million people waiting for help, can we afford to lose any facility, or can we afford not to fix them? This crackdown is a wake-up call. Do you think shutting down these centers is the right move, or does it make the crisis worse? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that impacts your life.